Ever wondered if you're doing everything you can for your post-therapy knee recovery? Do those moments of uncertainty about whether to ice your knee after therapy leave you seeking clarity? Join me today and discover the key to optimizing your healing process. Hi, I'm Dr. P. I'm President and CEO of Victory in Motion. Got a problem with your knee? Call Dr. P. So let's dive into the crucial topic about icing your knee after therapy. After a therapeutic session, icing proves beneficial for managing inflammation and reducing pain. Discover the optimal time frame for icing, avoiding common pitfalls like cold burns and the importance of periodic ice application. Learn the do's and don'ts, including when to skip the ice and why consulting a doctor is crucial in certain conditions. Stay tuned for expert insights on physical therapy rehabilitation, emphasizing team awareness, personalized plans, and a focus on prevention for a comprehensive approach to your well-being. So, I get a lot of questions. Question number one, should I ice my knee after therapy? Well, yeah, after a therapeutic session, the decision to ice your knee depends on the nature of the therapy and your specific condition. In general, ice ceases swelling and is beneficial for managing inflammation, thereby reducing pain. So ice is a vasoconstrictor, meaning it narrows blood vessels. This reduces tissue bleeding and swelling, and it helps ease that swelling and alleviate pain. So this is why applying ice is often recommended in post-therapy scenarios to manage inflammation and swelling effectively. Another question I get is, how long do you have to ice after therapy? So physical therapists commonly use ice to reduce inflammation following manual therapy or exercise sessions. It does aid in optimizing the therapeutic effects and promoting a smoother recovery. In general, a standard recommendation for icing after therapy is, use a timer. So use a timer to ensure you ice for at least 10 minutes, but never more than 20. So 10 to 20 minutes. 20 is fine as long as you keep that timer. And try not to go longer than that in one specific session. This time frame strikes a balance for effectiveness without risking adverse reactions. So like what type of adverse reactions? Well, cold burns. We want to avoid cold burns. So be cautious to prevent cold burns. And I know that sounds kind of weird, like doesn't heat burn? Well, yeah, cold can burn too. You can get frostbite. So we want you to be cautious to prevent these cold burns, as they can counter the benefits of icing as the body reacts by increasing blood flow to warm the area. So sometimes if you ice for too long, you might not get to that point of frostbite. But what happens is if you overdo it, then your body's going to overreact and send more blood flow into the area, and that can sometimes cause increased swelling and pain, believe it or not. So keep it at the right amount of time, just like Goldilocks. Also, keep that application within the recommended time to avoid unintended effects. You want to ice periodically. So what does that mean? Well, you don't want to ice nonstop 24/7, but periodically. So 20 minutes per hour is probably the maximum. And you usually want to do that in the initial 48 to 72 hours following an acute injury, which means an injury that just occurred within a few days, a week or so. And that helps manage inflammation and supports the early stages of the healing process. Another question that I get is what to avoid when icing an injury. When you're icing, remember that shorter is often better. Stick to that 10 to 20 minutes to avoid potential issues. Always use a cloth or a towel between the ice and your skin. Again, we don't want to get frostbite, and that helps prevent those frostbite burns and irritation. And also, don't ice and forget it. Don't fall asleep with an ice pack on, just like you don't want to fall asleep even with a hot pack on. So keep an eye on it. 20 minutes might be too much for you. You might have more sensitive skin, whereas other people, 20 minutes might be fine. So make sure everything is comfortable, everything's safe, you're not falling asleep, you got something in between the ice and your skin. And also, remember this, if you have an area that's numb or decreased sensation, a lot of diabetics have that, in their legs especially, it might be best to either skip ice or be very limited or keep a very close eye on it. And also, same thing, skip warm packs if you have areas of skin that are numb, because you can't monitor, if you can't feel it, how are you going to monitor it? You don't know if you're causing harm. So if it feels numb, skip the ice. It's important not to cause more harm. Also, avoid putting the ice on cuts or incisions or wounds. Number one, it could slow down the healing process because you want blood flow to those areas to help heal. But number two, we worry about getting wet, getting it macerated, meaning kind of like dishpan hands, and then that increases the risk of infection. So we don't want that. So don't ice directly on an open wound. Also, ice after exercise, not before. So if you ice before, you're going to tighten things up, and that may temporarily affect your muscles, making you more prone to injury. Also, there are people who have diseases like Raynaud's disease where they're sensitive to the cold. So if you're sensitive to cold or you have a condition like Raynaud's, consult a doctor before using ice. Always ask your own doctor. That goes for any of the stuff I talk about. This is education. This isn't advice. Always ask your own doctor, your own therapist, what they think, because they know you the best. What sets us apart from others when it comes to physical therapy or rehabilitation? Well, first of all, we work as a team. We have a team awareness. We function as a team. We maintain constant communication with all the healthcare providers in our office, not just the rehab specialists, but the orthopedic providers, the radiology technicians, the nursing staff, all of the clinical staff, even the support staff. We're a team. We function together, and every little piece of information from each team member is only going to help you. So in conclusion, the decision to ice your knee post-therapy hinges on the therapy type and your unique condition. Ice effectively curbs swelling and manages inflammation, promoting a smoother recovery. Follow the recommended icing duration, avoid cold burns, frostbite, and ice periodically, not constantly, within that first 48 to 72 hours of an acute injury. Remember, shorter sessions are often better. Stay vigilant during the icing process, prioritize safety, and consult your doctor, your physical therapist, your rehab specialist if you have any specific conditions or questions. Explore our unique approach to performance physical therapy rehabilitation, as well as individualized, personalized, total body metabolic fitness, otherwise known as VFit, focusing on a team awareness, individualized plans, and a commitment to injury prevention for a holistic healing experience. Our next video delves into the FDA approval of bridge-enhanced ACL repair. Join us to unravel the latest advancements in ACL treatments and make informed decisions on your path to recovery. Remember, if you have a problem with your knee, call Dr. P.